Fidelity just released their 2025 retiree healthcare cost estimate, and the number is pretty staggering. $172,000 for a 65-year-old retiring today. Most Americans haven't planned for this. So today in this video, we're going to try to help you better understand what this means, what you can do about it, and why it matters so much in retirement. Welcome in. This is Dollars with Dennis. Glad to have you once again on the show. Ben George with Dennis Hoare of Faith 401k and Money Management. Dennis, healthcare, nobody really wants to think about healthcare costs, but man, we've seen them increase over the last 20 years quite a bit, haven't we?
We have. And whether we want to think about them, we are thinking about them because the prices keep going up and it's more and more every day.
Yeah, it is. And I'm going to drop this Fidelity healthcare cost estimate into the show notes. You can kind of read through it for yourself. I think this is the 24th year they've done it. And it's interesting to kind of see, Dennis, as we dig into the numbers and why this matters so much. The estimate has grown from 80,000 in 2002 to nearly more than twice that, a little over 20 years later. Pretty remarkable increase. So why is it so important that we understand what this cost is going to be and start thinking about it today?
Main thing is $172,000 might be all somebody has in their retirement account when they go to retire. So if you haven't thought about what it takes to live in retirement with healthcare, I mean, you got co-pays, you got premiums for Medicare and Medicare supplements, stuff like prescriptions. There's lots of expenses that don't get covered on top of the premiums. So we need to have that, and that can put a big dent in your retirement plan if you're not prepared for that.
Yeah, so much. And I think it's interesting that this number doesn't even include long-term care, right? Which can be another big bump in expenses on top of that, right?
Huge. Yes, you're right. That's a whole nother subject. We could spend the whole day on long-term care, but healthcare costs in general are just, most people have not thought about how much it's, maybe they've thought about it, but they don't know, they don't feel the impact of what, if it doubled into 20 years, they're probably going to live 20 years in retirement. What if it doubles again? What does that do to their nest egg or their retirement egg? So it's important to at least consider the cost and think about the ways to try to deal with it and prepare for it.
Well, you mentioned, maybe people have thought about it. Well, actually, the study shows, Dennis, that that's one of the big blind spots here is that 1 in 5 Americans never considered healthcare costs. So 20%. These blind spots that are out there are pretty significant, and it's a reason why it's worth bringing this up, right?
It is. Yeah, the blind spots. If 1 in 5, really, that's crazy. That even surprises me. That you're going into retirement and you haven't thought about healthcare costs. It is a big portion of expenses. So, and many people don't know or realize that Medicare doesn't cover all the costs of stuff, and there's a lot of gaps in you've heard some people refer to the donut hole and different things where you got co-pays and deductibles. So even if they're a normally healthy person, just doing the routine things, you're going to have out-of-pocket costs through retirement. And I don't see any sign of it going down or slowing down, even for that matter.
Yeah, and even on top of that, 1 in 5 Gen X who really now has to start thinking about retirement a little bit more. They're at 25% haven't considered it at all. So they're even more unprepared than the current generations. Not surprising as they're a little further away, but still.
A little further away.
Not a great spot.
Probably all of us, myself included, need to be pointing it out to people more. And Fidelity's been good at putting these numbers out every year about the healthcare costs. And so when I saw that it was 172,000, it even surprised me a little bit on that. So be prepared because it doesn't get cheaper and it's a lot of money.
Another thing from this estimate, Dennis, too, is the healthcare, the health savings account. So they didn't mention that adoption has increased some with the HSAs and people using them, but there's still a lot of potential there for people. And honestly, a lot of people that still haven't utilized this, they could.
Some people don't qualify to have an HSA health savings account. HSA, high deductible medical plan, allows people to have a way to put away money, and it's a triple tax advantage. So as it goes in tax-free, grows tax-free, and if it comes out for medical expenses, it is tax-free at that point. So it's a great tool, and we encourage every client to have one and and try to get it built up. And when to use it is kind of like Roth IRAs. We always think that might be the last money we use if we don't have to. And HSAs, if healthcare is going to be that expensive in retirement, we may want to be careful when and how we use what we have in our HSA, so we have some longer down the road, and keeping it invested for longer will help as well. And some people don't realize you can invest the money in the HSA as well. So that's a whole nother topic. But they just go into a bank account. But most of them, after you get to a certain dollar amount, you can actually invest into an index or a fund of some sort to grow better.
Yeah, the stat from this was 23% contribute to an HSA, but just 3 in 10 of those actually invest the fund. So to your point, yeah, I mean, just a little more education in that spot would be very helpful for people. What about Medicare? That was the other thing pointed out. The complexity of Medicare might be kind of holding people back a little bit too. I think, as we touched on earlier, most people think that Medicare, or a lot of people think that Medicare is going to cover most costs, which is a misconception. But just the complexity of Medicare is usually a hurdle to get over, isn't it?
If anybody understands Medicare, I'd like to meet them. I've had client seminars, workshops, 3 different ones this year, and I come away with something new every time we do it. It's complicated. It's a lot to do. So I think that's why a lot of people avoid or don't think about it or don't want to think about it, just because it is pretty complex. And they stress out over just the getting enrolled and set up for it, because there's some things in there that they don't do correctly. It's a long-term penalty for them if they don't do it right. So I think it's important to have options and get support and as much education as you can on Medicare, and start early. I think right now they say give Medicare 90 days to be set up and enrolled and stuff to go. I would start about 120 days. So I would rather be early than late, and be ready to go there, because it is a lot, and you got to pick the plans. You got to choose what is best for you, and some of it has to do with what area you live in. Some of it has to do with what health conditions you may have already. So there's things that go around Medicare and the complexity that really slows people down and keeps people to avoid it just because they don't want to deal with it.
Yeah, I can see that. So let's close it out then with maybe some strategies. So if someone's thinking, okay, I haven't thought much about healthcare, I'm in that group that hasn't spent a lot of time planning for it. Let's talk about some strategies then. Leave some people with some strategies they can use to reduce this burden, because it could be significant in retirement.
Yeah, so leave it to me. I say have a plan. So we like to put healthcare expenses into retirement planning so that we're accounting for those dollars and do this. So start early, getting the sooner you have money going towards healthcare savings, the quicker you're going to get there and the better prepared you will be. Use HSA strategically. Again, time when you're doing contribution withdrawals with your tax bracket and where you are, because you don't want to cause yourself to miss a tax opportunity. So having tax professionals coach you and walk you through on the best way to use your HSA and when to do it is important. And then talk openly with your family and your advisors around you, so that healthcare costs are a lot, and you don't want to leave anything unplanned, because we want to be prepared. We can't predict the future, but we can plan for the future with what we know.
Absolutely. So get in touch, 401k.faith, if you want to learn more, if you want to have a plan that you start building now to think about healthcare and consider how much that could be potentially if you're retiring in 10, 15, 20 years. Could it double again? We don't know, but you want to be prepared for that possibility. And again, this is one of the biggest wild cards in retirement. And that estimate from Fidelity that you'll find in the show notes does kind of point out that costs are rising. It's not meant to scare you. It's just hoping to push you towards preparing a little bit better for it. So make sure you have that plan in place. Get in touch with Dennis if you haven't gotten someone to work with you and help you paint the picture of what it's going to look like moving forward. But we appreciate you watching this video, and hopefully this helps give you a little thought about what healthcare could look like for you once you reach retirement. So thanks for watching. Please subscribe as well. Hope you have a good week, Dennis, and look forward to talking to you again soon.
Thank you, Ben. See you.
Securities and investment advisory services offered through Osaic Wealth, Inc., member FINRA SIPC. Osaic Wealth is separately owned, and other entities and/or marketing names, products, or services referenced here are independent of Osaic Wealth.